So first I'm going to be performing hand hygiene and then providing privacy. All right, so I'm going to introduce myself to my patient. Hi, I'm Arabella and I'll be your nurse today. Can you please tell me your name and date of birth?
My name is Tommy Ho, May 8, 1998.
All right, awesome. So today we're going to be performing a passive ROM assessment on you. Is that all right?
Yes.
Okay, can you please rate your pain from 1 to 10?
2.
2? All right. Okay, so now I'm going to raise the bed to workable height and lower the railing. And no skin lesions are present, so I don't have to wear gloves. So I'm making sure that the patient is in a comfortable position. Are you comfortable?
Yes.
Yes? All right. So starting with passive ROM on your shoulder, it's going to be the flexion and extension with the patient supine and the arms to its sides, or his side, sorry, and palms down on the bed. I'm slowly going to raise the patient's arm forward and then back and above his head. And then you don't have to do anything. Please put all your pressure on me, okay? And ensuring that the palm faces up. How does that feel for you?
Fine.
Fine? Okay. And usually we'd be performing this 5 times. However, I'll just do it once for the video. Okay? So now we're going to be performing shoulder abduction and adduction. So with the palm facing the thigh, I'm going to be doing a sweeping gesture. How does that feel for you?
Fine.
Fine? All right, awesome. So then now I'm going to be performing a horizontal adduction. So I'm going to position you with the arm extended away from the body and the palm facing up. I'm going to move your arm perpendicular to the body. So then now we're performing horizontal adduction. So just bringing his arms towards the body with the palm facing up. All right, how does that feel for you?
Fine.
Fine. All right, so now we're going to be performing a shoulder external rotation. So then with myself facing your head, I'm going to position the elbow as well as elevate it at 45 degrees. So now that his elbow is elevated, I'm going to hold his arm by the forearm and hold my hand at his elbow and then move up. How does that feel for you?
Fine.
Fine. All right. We're going to be performing a shoulder circumduction. So my patient is already sitting up, and then please have your arms at your side. All right, thank you. So now I'm going to grasp his wrist, extend the arm while supporting the elbow, and then slowly moving in a counterclockwise motion. Now I'm going to be going in a clockwise motion. All right, so how does that feel for you?
Fine.
All right, now please lie down. Okay, so now we're going to be performing wrist hyperextension. So I'm going to be slowly lifting his forearm, and then with his curled fingers, I'm going to bend his wrist as far back as I can, and then bend his wrist as far forward as I can. All right, how does that feel for you?
Fine.
Fine, okay. And now we're going to be performing a wrist abduction and adduction. So please keep your elbow in contact with the mattress. Now I'm going to slowly raise my patient's forearm perpendicular to the body. supporting the patient's arm below the wrist with one hand and grasping the patient's hand with the other. And I'm once again going to pull back as far as I can and forward. How does that feel for you?
Fine.
Fine? All right. So now we're going to be performing a passive ROM on the patient's finger. So with the patient still supine with the arms to its side, we're going to be supporting the patient's hand, exercising each finger. So I'm going to be bending and straightening each joint. Now we're going to be performing finger abduction and adduction and moving it side to side. All right. Now we're going to be performing passive ROM on a patient's knee. So, all right, with the legs straight and uncovered, I'm going to place one hand under the patient's ankle. Now we're going to be performing passive ROM on the patient's knee. So I'm going to be grabbing the bottom of his foot, and with my hand underneath his knee, I'm going to be lifting it and then straightening it. How does that feel for you?
Good.
Good? All right. So now I'm going to be performing ROM on the patient's ankle, foot and ankle. So then I'm starting with the patient's legs and feet straight and uncovered. I'm now going to place one hand under the patient's ankle and lift the patient's foot off of the bed. Now I'm going to be placing the patient's my hand under the patient's ball of the foot, and I'm going to press gently until the toes are pointed up. How does that feel?
Good.
Good? All right. So then now I'm going to be performing a foot and ankle inversion and eversion. So I'm going to place one hand under the patient's ankle and slightly lift the patient's foot off of the bed. How does that feel?
Good.
Good? Awesome. All right, so now I'm going to ask the patient once again, can you please rate your pain from 1 to 10?
1.
Oh, a 1. Okay, thank you. So, did you understand the purpose for these ROM exercises?
Yes.
Can you please repeat some of the stuff that I did with your thing? With your arm?
You bent my arm.
Like this?
Yeah.
All right, and also?
Upwards.
All right, good job. So now I'm going to tell the patient, now I'm going to lift the side rails and lower the bed, and I'm going to keep the call bell in reach and let the patient know to please use it in case you are in need of assistance. Then I'm going to perform hand hygiene and finished.